Guys, it's Dr. Knetzer at South Hills Physical Medicine again. Last couple of weeks, we haven't had a video, but prior to that, we were focusing big time on new lean and nutritional components to your healthcare. So I kind of wanted to shift the focus to knees. We had covered this topic a little bit before, and we've had patients come in recently, I think, that have been seeking a little bit different of a choice or a little bit different of an out. So we've had patients that have been told that there's no other option besides surgery. We have patients that maybe are getting elderly and don't have even surgical intervention as an option, and they're looking at maybe possible narcotic use or something like that they have to deal with, or to deal with their pain. So the idea behind what we're trying to accomplish with our patients is, I would imagine, somewhat novel. Is we're trying to make people understand that most things, and especially our knees, they cannot be looked at as purely a one-faceted problem. So if we talk about degeneration of the knees, most of the times there is a genetic variable that's going to play in, and I don't think most physicians will deny that. But the fact of the matter is that osteoarthritis, we know, is either a result of repetitive microtraumas, so whether that's walking repetitively on hard surfaces, or we're talking big traumas. So say you have dislocations, fractures, even contusions that may have arisen from sports or different activities. We have all of these different factors that are involved in why are we getting knee osteoarthritis, okay, or degeneration of the knee in general, okay? So when I say things like repetitive biomechanical stresses, I'm talking about taking a person who is 50, 100, 150, 200 pounds overweight. Every single step that you take is applying more force to that knee joint than it can handle. And over years, it starts to fail. So when we talk about things like new lean, which we were talking about a lot, and we still are pushing as hard as we possibly can because we agree with it so much, the idea is that whenever you lose weight healthily, you can help things like your knees, okay? When we start to address things from a biomechanical standpoint, we can alleviate most of the pain that we're having even prior to getting to a point of degeneration and osteoarthritis. So in our office, we've always been big fans of hyaluronic acid supplementation. I know a lot of you have heard of the Rooster's Cone, and we talked about that weeks and weeks ago. So in the office, when somebody comes in, we're going to talk to you about using things like hyaluronic acid, which is an all-natural, I shouldn't say all natural, it's a synthetic product that replaces what's naturally in your knee, to help you avoid things like advanced osteoarthritis. So whenever people are having pain, whenever you guys are having pain, have the mindset that it is not a one-faceted approach that you need to get better. So think of it as a biomechanical thing. You need to learn that the weight that you're putting on your knees on a constant basis is no good for it. Certain daily activities that we can help and guide you through can be functional in getting better, and as well as approaching it from a nutritional aspect as well. So if you guys have any questions regarding any of those types of issues involving knee pain, just let us know. Like I said before, we offer a free consultation for anybody that, if you don't know you're in the right place, or you just have a few questions for us, just reach out to us, okay, guys? Have a nice weekend.